first day I found out I was pregnant, I was actually scheduled to have a surgery, and I was in the gown, everything ready to go into surgery, and they tell me I'm pregnant. Yeah. I was in complete shock. When I went to my old doctor, I felt judged because I'm 16, I'm pregnant, and when I came here, it's normal. It's not, you don't feel judged, you don't feel like ashamed of being pregnant at a young age.
Here at the Outreach Center, we're working with approximately 450 young people each year, and that would include about 40 young dads who are involved in our programs, and in addition to that, 300 children under the age of 4. I received a phone call from Dr. Fleming, and she was initially exploring whether there was anything that St. Mary's Home might have to offer at the hospital. And as we talked, she said, "Do you think you'd ever consider trying to run a clinic here?" It was kind of like a light bulb goes off, you know, and she had this brilliant new idea. And we both looked at each other and said, let's try it and see what happens.
Dr. Fleming is a great woman. The first day I met her, I wasn't even a patient of hers. I was feeling pain, like in my lower back, and I went into her office and I asked if she could see me, and she took me right away, surprisingly.
Alors la clinique ici à St. Mary's est très unique et innovatrice parce que nous avons amené le soin des adolescentes, le côté médical dans un centre adapté pour les adolescentes. C'est un centre qui est unique au Canada. Il n'y a aucun autre centre au Canada où l'équipe médicale se joint à un centre pour les jeunes femmes. Pregnant adolescents are high-risk young women for many reasons. Unfortunately, many of them have had a very difficult life. Some have history of violence. Many have challenges with mental illness or addictions. And many have no family doctor or have no access to medical care. Research has shown that young adolescents don't tend to seek prenatal care until much later. We can just imagine if they're accessing care in the first trimester and they have all these medical and social needs, we can intervene on their behalf or get them plugged into the medical system. And what we found was that our adolescents came to their prenatal visits much earlier and more often. They also had a lower rate of cesarean section, an improved rate or a lower rate of preterm births, and they also had healthier weight babies at birth. Addison obviously is a very special woman, a young woman. She has embraced St. Mary's and been able to access many of their programs. It is fun and it is challenging at the same time to look after these young women, but Addison and others are great patients to have.
I think St. Mary's is important to the community because I find there's a lot of pregnant teens in Ottawa. I see them everywhere. We're so fortunate to have this here, and it's a great resource because not all places have something like this. Usually you just go to a regular hospital and, you know, live your pregnancy alone. You're never alone here. You always have someone who's gonna help.
It's a little piece of the Ottawa Hospital here in Vanier in the community center.